Good day, everyone. I am Jessie Jane Madanlo, and together with my groupmates Boris Pamilik and Mike Ligtas, we are excited to talk to you today about the very important topics. Ethical issues arise when technology intersect with healthcare. Our discussion highlights how technology changes, how healthcare delivered, and but also brings new responsibility for protecting patients. In this age where heartbeats meet algorithms and compassion travels through cables, healthcare ethics guide us in balancing innovation with respect for patient rights and safety. In this topic, we're going to explain the ethical principle that should guide how we use technology in healthcare. Then, to understand the benefit and challenges that come within these technologies. And lastly, to see how ethical decision making and laws like the Philippine Data Privacy Act apply in real nursing practice setting. Remember, this isn't about stopping progress. It's about foundation that makes technology safe and trustworthy for patients. And now let's talk about the theoretical foundation. Data protection and security are crucial. We have to keep patient information confidential, safe from unauthorized access, and accurate. The Data Privacy Act of 2012 in the Philippines legally enforces this protection and requires healthcare bodies to appoint data protection officers to oversee compliance. The concept of digital beneficence reminds us that technology should serve the patient's best interests, not show overshadow their dignity. But as exciting as innovation is, it also brings ethical dilemmas when technologies reach challenges our core care values. Now let's proceed to the ethical theories and frameworks. To navigate these dilemmas, we rely on well-established ethical theories. Deontologists emphasize duty, reminding healthcare workers not to treat patients as mere data but respect their privacy and autonomy at all times. Utilitarianism asks us to balance benefits and risks. Does this technology truly improve overall well-being? Virtue ethics calls us on to act with integrity and compassion, even when complex digital environments. Deontologist says protect privacy no matter what. A utilitarian asks, is this technology maximizing benefit for as many as possible? And Virgin Nurse wonders, am I carrying honesty and truthfully as use this tool? Using these ethical lenses, we can better understand the realities and challenges behind data protection, the promises technology offers to improve healthcare, and the dilemmas we face to keep the care humane and ethical despite rapid digital change.
Now let's discuss a case study, AI patient monitoring and data breach in relates to subtopic A, data protection and security, subtopic B, benefits and challenges of technology, and subtopic C, current technology, issues and dilemmas. Let us look at a real ethical case inspired by the findings of Se and colleagues in 2020, who studied many healthcare data breaches worldwide. Our case takes place in a provincial hospital that installed an AI-based monitoring system to record patients' vital signs. One morning, a nurse discovered that some sensitive patient files, including HIV status and psychiatric notes, were accidentally uploaded to a public cloud server. The hospital claimed the system improved patient safety, but the nurse worried about possible violation of the Data Privacy Act of 2012 or in RA 10173. Now let's look at the situation through different eyes. The patient feels fear and embarrassed, wondering who might see their private information. The nurse feels torn, wanting to protect patient but also fearing punishment if she reports it. The family worries about stigma and loss of trust in the hospital. The hospital administrator focuses on efficiency and reputation. The IT vendor, however, sees a technical glitch, not a moral problem. Nevertheless, the National Privacy Commission, or legal regulator, sees a duty to enforce confidentiality and protect public trust. Now, here lies ethical conflicts and tensions. Technology in healthcare often begins with good intentions to help, to heal, and to save. But as we see here, every intention comes with an ethical tension. Let's think about it together. This subtopic B is visible here. When the AI system gathers patient data, it aims for beneficence to improve care, that's benefit. But did it respect autonomy? Did it ask? That's a challenge. When the hospital analyzes all records to boost performance, that's utility. That's a benefit. But are we protecting confidentiality? That's a challenge. Subtopic C is also visible here. When something goes wrong, who stands accountable? The nurse who noticed the breach, the IT vendor who built it, or the hospital that allowed it. Our intentions may be good, yet ethics ask at what cost and to whom. That's why we need a structured way to decide, a framework to guide us when the right path isn't easy. Let's walk through this together as if we were the nurse in this case. Step 1. Identify the problem. A patient's private data has been shared without consent. That's more than a tactical glitch. Step 2. Gather the facts. What exactly was exposed? Who accessed it? Was it accidental or negligent? Step 3. Identify stakeholders who are affected here: the patient, the nurse, the hospital, the vendor, or the public trust itself. Step 4. Apply ethical principles. Now let's ask which principles are being violated and which are being upheld. Autonomy is violated, confidentiality is broken, but beneficence may be partly upheld since the AI is intended to improve care. And justice demands fair redress that no group suffers more than another. Now let's proceed to step 5. Generate and evaluate options. Here we think, what should the nurse do? Should she stay silent to protect her job or report the incident to protect her patient? What must she consider? The law, the RA 10173, the code of ethics, fidelity, and then maleficence, the patient's dignity. Sometimes the right thing is rarely the easiest. Step 6. Decide and act with integrity. Now we choose the solution that respects both ethical and legal duties. Proposed solutions include contain the breach and notify the patient, report the incident, secure the system. So this follows the law. It is legal. It follows the RA 10173. Then we strengthen encryption and access control. We update consent forms to improve autonomy. We provide emotional support to affected patients. This enhance beneficence, involve nurses and technology policy decisions to improve non-maleficence. Then we ask ourselves, does the solution respect the patient? Yes. Is the solution ethical? Yes. Is it legal? Yes. Then we are walking the path of moral courage. Artificial intelligence offers precision, but who answers when the system fails? This reminds us that a progress should never erase compassion. Thank you.
Good day everyone, good day sir. My name is Ligtas Mike Justin from BSN2A, and today I will be reporting the last part of our topic, which is the application of nursing practice. So my discussion will focus on how nurses and us as a future nurses apply ethical principles when using technology and healthcare. So first, let's talk about the application of ethical technology used in nursing practice. So, in today's healthcare system, ang technology is already part na jud siya sa nursing practice. So, we use computer for documentation, digital thermometer, and even telehealth. But along with these advantages come ethical responsibilities. So, as a nursing student and a future professionals, we must always protect jud sa privacy sa atong patient ug dapat mo follow jud ta og Data Privacy Act of 2012, which is we have to ensure nga ang all personal health information sa ato ang patient is remain jud privacy, which is we have to remain confidential. And we should always be professional in how we use our gadget, social media, and hospital computer. So next is we have the implication for nursing practice. So Ethical practice meaning balancing the technology and compassion. So for example, even ang usa ka information is digital siya, we must still ask for informed consent before ta mag-share og any data. So also nurses is serves as a advocator. So making sure nga ang technology is used ethically in hospital. And most importantly, ang usa ka technology di ba nag-help siya para makasave ta og time para mas mapadali ang ato ang pag-take care sa ato ang mga patient. But it should never replace jud kung unsa ta mag-take care sa atong patient as a human ug unsa ta maghatag og empathy nga ginapangita sa ato ang patient. So next is you have the Code of Ethics. So in Philippine Nursing Code of Ethics, you have the Article 2 and Article 3. In Article 2, Section 2, we have to keep all the patient information. And Article 3, in Section 1, we have to respect the right to privacy. So, it is our duty, Jude, nga we have to protect and secure the information of our patient as clearly stated in the Philippine Nursing Code of Ethics. So, it says that the nurses must hold in confidence all personal information and respect the right to privacy. The NAEA Code of Ethics also reminding us or as a future nurses to protect the rights, health, safety of our patients. So as a future nurses, we must already practice ani nga mga value even during sa ato ang training pa or karon o sa ato ang community exposure. So next is you have the practical recommendations. So here are some practical things we can do. So first is you have to always follow the hospital privacy policies. And second, if we are unsure, we can ask our clinical instructor or the ethics of committee for help. And third is we have to help educate patients about how their data is stored or used. And fourth is we have to attend trainings related to data protection. And lastly, we have to practice honesty and professionalism and even simple nga mga actions like logging out of sa computer after ta used to show integrity. So, as a nursing student, I realized nga ang mga nurses is dili lang sila mga caregivers, but also sila pud ang ginatagaan og mga trust sa mga patient or in short, sila ang guardian of trust. So, each time nag-handle sila og information sa patient, which is nag-carry jud sila og big nga responsibility. So, ang technology can make our work easier, but the ethics can make our care meaningful. So, every click, every record nga atong ginabuhat is nagamatter jud siya and should always reflect respect and professionalism. So to conclude, using technology in nursing is not just about convenience. It's about responsibility o respect. So by protecting the privacy sa ato ang patient and acting ethically, we can build trust and safety sa healthcare nga environment. So that's my report on application to nursing practice and conclusion. So thank you, sir. Thank you, everyone. And I hope this reminds us that being ethical is one of the best way to show real care as a future nurses.